Hi, Lighthouse Lindsay here, back again with another Lunch and Learn. And today we're going to continue the conversation around Medicare Part A and what type of coverage is offered at what fee. So, last time we talked a little bit about hospitalization and what is covered. Now, I want to discuss if you were to need skilled nursing care after your hospitalization, what would that look like cost wise, and how do you access that level of care? So, the very first thing that you need to be mindful of is that you have to have had a qualifying hospitalization, meaning you were admitted for at least 3 days. Those days have to be consecutive and it cannot be observation, it has to be an admission. So, after those 3 days, perhaps you go directly to the skilled nursing facility, or maybe you go home and then your family realizes that you do need a skilled nursing facility. They just cannot provide your care at home. You have to get to that skilled nursing facility within 30 days of your discharge from the hospital stay. You also need to make sure that the diagnosis that they were treating in the hospital is the same that they're treating in the skilled nursing facility, or Medicare will not be covering any portion of that stay. So once you've got all those things established, you're ready for your admission, what is going to be covered from there? So from day 0 to day 20, Medicare will cover the entirety of your stay so long as you've already met your deductible. And again, that's $1,736 for the year 2026. So being that you've already met that deductible, Medicare will cover the cost of your stay up until day 20. Once you've hit day 21 up until day 100, Medicare will charge you a $217 coinsurance per day for every day that you're there up until your 100th day. Once you've reached your 100th day, they will not cover any costs at all. You'll be on the hook for the entirety of your care should you need to stay past that 100th day. So again, I cannot stress enough, it is super important to, again, look for Medigap coverage before you need it. Because there are additional fees associated if you don't get into that early on. And then also do maintain your supplemental through your prior employer, if at all possible, to make sure that you get that additional coverage, because it is highly possible that those plans will cover those co-insurances or that above and beyond price once you've reached that 100th day. If you have questions about this, leave me a comment or like below.